Hello, dear audience. This is Dr. Yulia again. All we know that the real wealth is the health. Today, I would like to talk about the new pathogenesis of coronavirus and explain the next questions. Why the hydrochloroquine is so good for the treatment of COVD and why Afro-American people has a high risk to have coronavirus. And the third question, why a lot of patients with COVD has a higher level of the ferritin. So let's start it. As we know, in our blood, we have red blood cells or erythrocytes that produced by bone marrow. These erythrocytes take oxygen and has a big concave shape that helps to take oxygen more tightly, and from the lung, oxygen by erythrocytes transferring to the all tissue of our bodies and create the circulation. After that, erythrocytes take CO2 from the tissue and bring back to the lung. The next question, very interesting, that the erythrocytes has the next structure. So it's hemoglobin or heme is ion of the ferrum with state 2 plus, because only the 2 plus state able to carry oxygen. And 4 globins, it's like 4 proteins. So all oxygens go to the all 4 globins and take care from the lung to the tissue. The next, if we don't have enough of heme or globin, we're not able to have that good oxygen supply. So what happened with coronavirus? Coronavirus, then in the blood, is attached to the heme and reduce oxygen supply. That's why the people has a fatigue, weakness, and shortness of breath. It may explain as well why a lot of patients has the pulmonary edema, because then the level of ferritin is the pour of iron increase in our body. It means that we have inflammation. It could be any virus infection. And the third reason, the main reason as well, is bleeding. So in this case with coronavirus, we have a high level of ferritin because the coronavirus destroy heme, and the body trying to produce more heme to help our body react on this infection. The second, a lot of nurses and doctors saw that the blood more darker for the patient who has COVD. Why it happened? Because the blood more deoxygenated, and the doctor using hydrochloroquine to help not to have attachment of coronavirus and to protect him from destruction, because as usually the hydrochloroquine is very useful for malaria, and malaria is protozoa. So the third question that I would like to explain, why Afro-American people has a higher risk to have a coronavirus, because ethnically they were protected more from the malaria in their countries, but since we move, they have a slightly low level of hemoglobin, approximately 0.9, 0.8 milligram per deciliter. So that's why they have more susceptibility, and it could cause more destruction of heme. The next that I would like to explain, it's that we need to treat ourselves, because the free radicals that created from the destruction of the heme could cause the main inflammation. So better to use the fruits and vegetables, because they are the best antioxidant. To the best antioxidant belongs that fruits that have a vitamin C. So what kind of fruits? It's a blueberry, most of all. Acai has the highest level of vitamin C. It belongs to the superfood. All citrus. So try to eat with skin the fruits. and vegetables, and stay healthy. The normal food intake, especially for the fruits and vegetables, is 600-800 milligrams per day. And I would like to explain that the food, we are taking the heme and non-heme hemoglobin. So hemoglobin, according to the dietary and nutrition guidelines, contains in that animal food, like beef especially. And non-heme, it's more currently exists in lentils and in other fruits, but if you don't have enough vitamin C, you're not able to absorb the serum in the erythrocytes. So please use vitamin C, and it helps to absorb more serum and stay healthy. So I wish you the good luck. I wish you to stay healthy, to stay positive. And this is your Dr. Yulia. Send you the positive energy. Bye.